Today we have to discuss about the topic is acute necrotising ulcerative gingivitis in periodontal disease. It is a endogenous oral infection. It is characterized by the interdental papilla get infected that lead to necrosing. It is also called as trench mouth because this kind of disease is mostly seen in the trench troops. So it is in etiology it is due to mostly that stress and anxiety that stimulate that immunosuppression that via the corticosteroid. The corticosteroid leads to immunity get suppressed. So the suppressed immunity at the same time viral infection and vitamin deficiency, particularly vitamin C, stimulate that immunosuppression. That immunosuppression leads to increase the bacterial growth. In fact, people those who are having pre-existing gingivitis pay the way also stimulate that necrotic ulcerative gingivitis. Factors causing acute necrotic ulcerative gingivitis, that is two factors. One is systemic predisposing factor and another one is local predisposing factors. The systemic predisposing factor is nothing but it is our body conditions, our whole body involvement, like malnutrition. The malnutrition is for example, we are doing the some or I am doing that gastric surgery that leads to malabsorbed vitamins, so that leads to that this kind of condition necrotic ulcerative gingivitis. At the same time, nutritional deficiency, vitamin C, vitamin B1, B2 leads to that for the growth of Phaeospirochetal bacteria that leads to the necrotic ulcerative gingivitis. And psychological condition like stress, the stress stimulate corticosteroid. The corticosteroid pave the way for immunosuppression that leads to gingivitis. And diseases like leukemia, like AIDS, this kind of diseases also leads to immunosuppression. So that stimulate the bacterial growth. The localized predisposing factor means that is this systemic localized predisposing factor particularly affect the gingiva, like marginal gingivitis and poor oral hygiene, faulty dental restoration. The faulty dental restorations leads to that for example, micro leakage is present between in the restorations that leads to bacterial accumulations and bacterial growth that affect the gingiva, so that leads to necrotic ulcerative gingivitis. And deep periodontal pockets, the deep periodontal pockets that leads to that accumulation of the bacteria that leads to gingivitis, necrotic ulcerative gingivitis. At the same time, tobacco smoke. Naturally our body our gingiva is simultaneously gingival repairment and gingival inflammation is get occurred simultaneously. So the tobacco smokers having those who are tobacco smokers that maintain that defective in that inflammatory responses, so that leads to that our bacteria get easily affected the gingiva, that they pave the way for the necrotic ulcerative gingivitis. In clinical features, it is usually occur among young and middle-aged adults because these kind of peoples only having the proper teeth and gingiva. In older individual, there is nothing. The older is having gingival recession. At the same time, they doesn't have a teeth, so it is mostly occurs in young individual and middle-aged adults. And stressed proportions like army recruits tend to suffer more from the disease. And malnutrition. Initially, the gingiva became red and erythematous and hemorrhage and painful, and there is a crater-like papilla will be seen. What is means crater? The crater means there is a depression in the area. So this kind of depression will be seen in the interdental papilla. So this will be seen, the interdental papilla will have this kind of appearance. So this is called as a punched out crater like erosion. And the pseudomembranous will be seen. The pseudomembranous is nothing but the necrotized interdental papilla is here, that pseudomembranous. So that kind of pseudomembranous leads to this necrotic ulcerative gingivitis. Sometimes we have to prove that the area we see that spontaneous bleeding will be occur. And headache, fever, malaise and lymphadenopathy, it is a common features. The lymphadenopathy is due to that bacteria get stimulated, the bacteria get pave the way for stimulation of inflammatory cells. That inflammatory cells stimulated by lymph nodes, so lymphadenopathy will occur. Often there is difficulty in taking food due to increased salivations and a metallic taste in the mouth. That metallic taste is due to the blood spontaneous bleeding in the mouth. So the spontaneous bleeding will result that metallic taste. And so we untreated that leads to that ANUG leads to noma or cancrum in the mouth. Investigations are associated with the testing of fusiform basil and spirochetes will be seen from the exudation of the ANUG. This necrotic ulcerative gingivitis exudate will be seen on the microscope. We see that spirochetes and fusiform bacilli will be seen. And we have to confirm that spirochetes and particularly Tripona pallidum, this kind of bacteria to confirm via by doing that fluorescent detection test and the ELISA test and antibody test. By doing this test to confirm this kind of spirochetes, differential diagnosis is much important because the doctors may confuse it is pemphigus or necrotic ulcer disease. By identifying these conditions by in benign mucous pemphigus seen in only in elderly peoples and no necrosis evidence, but acute necrotic ulcerative gingivitis patient having necrosis will be seen. This is the major difference between benign mucous pemphigitis and ANUG. And phemic lichen planus not show any foul breath, but acute necrotic ulcerative gingivitis patient having foul breath. Pemphigus have regular histology seen in older people. In acute necrotic ulcerative gingivitis, the patient having seen the gingivitis is mostly seen in younger individuals. Syphilis gingivitis is not get entrapped to adjacent gingiva, and streptococcal gingivitis there is a diffused erythematous. There is no necrosis occurs in this condition, but necrotic ulcerative gingivitis have necrosis. Gingiva stomatitis by candida, we have to scrap that whitish lesion which presents on the gingiva, and under the microscope we see the candidal hyphae will be seen. So we have to confirm. So we are confirmed this is a candidal gingivitis. The complications of this kind of disease, that is pulse rate get increased due to the pain, high fever, loss of appetite, loss of hungerness, and generalized lassitude. The people became very tired. This treatment, that is isolation of the gingivitis, isolation of the particularly inflamed area, and treated with the cotton rolls and dried. Topical anesthesia is applied. After 2 to 3 minutes, the pseudomembranous area get removed and goggled with warm water. After several minutes, we have to glue the warm water with 3% hydrogen peroxide to for cleaning the oral cavities. At the same time, twice a day, daily we have to give chlorhexidine mouthwash. Penicillin V, particularly 250 or 500 mg, and the erythromycins will be given to those kind of those kind of infected persons. Scaling is advised for the removing the debris, and root planning also done by the root planning is done by curate instruments. So curettage, gingival curettage and root planning is done, and we have to supplement to improve our oral hygienes and boost our immunity by giving the nutritional supplements. Thank you.